T-Bone and Heather in the morning on Star 98.3 and 97.7 The Bay.
Hi, everybody. 9 minutes after 8 o'clock, 8:09. It is Thursday morning. Time to check in with Dr. Polsky. Hi, good morning, doctor. How are you?
Good morning. Another lovely day in Southern Maryland.
Yes, indeed. I've become, it's like a habit now to hear your comforting voice on the other end of the phone. How was the first week of phase 1 in not only Calvert County, but Southern Maryland? How do you think it went?
I think things went pretty smoothly. We did have a few complaints here and there about just isolated places where maybe social distancing wasn't being observed, but for the most part, I think people were really doing a great job.
And how is the testing going in Calvert County right now? Where is the testing happening? Has it increased? What's happening with that?
I can speak to Calvert specifically and a bit for St. Mary's and Charles County.
Great.
Both in Calvert and Charles County, there is a vehicle emissions testing site in Waldorf over in Charles and Prince Frederick over here. St. Mary's, at this point, has testing. It's based a combination through their hospital and health department. To the best of my knowledge, is being done on the hospital property. So all three counties do have a general testing site. And then a fair amount of testing, I would say a gradually increasing amount of testing is being done in doctors' offices.
Oh, okay. So definitely more testing happening.
Yes, and we saw an increase of about two-thirds numbers of tests in our county over the past couple weeks.
We've had some calls, and I want to ask you this, and if this is something that you're seeing with the testing, are the tests all the same? Are they from the same manufacturer, and is there an issue with false positives, false negatives?
The testing that we're doing at the different sites, there's not so much a big issue with false positives with those. They do come from different manufacturers.
Okay.
There's still, I would say, a little bit of inconsistency from week to week as to how many kits are available from one particular lab or one particular manufacturer. But the tests we're using have all been standardized. I think the confusion comes in with antibody testing, which is a bit different. That the test sites we're checking for the virus itself, not evidence that someone has been exposed in the past.
Okay.
The antibody tests, which are not being done at the general test sites, but some individual doctors are ordering those. There is still some concern about the reliability and the potential for false positives, meaning that it could show a positive result, but that person may not truly have been exposed or be immune to coronavirus.
But that's for the antibodies. That's
Correct.
not for the actual virus if you have it in your body right now and are symptomatic or asymptomatic.
Correct. So the testing for the virus itself, the PCR tests, tend to be very accurate. If they show positive, it's almost 100% that somebody really has the virus. The deficiency there is that they're not 100% sensitive, meaning that there will be some people who may have the virus but may have very low levels of virus and it may not pick up.
So, doctor, I think you can tell by our questions, we're pretty much doctors at this point. So I have to ask the question. He says nothing. I have to ask the question because somebody called in and said this a couple days ago, and I think I know what the answer is, but I would like to hear
Because I
from
think
you.
you've addressed it before, but yeah.
So she said she had reliable sources saying that people were getting COVID-19. They're getting it, getting over it, and then getting it again.
Getting it possibly a third time.
Yeah, 2-3 times. Have you seen anybody that would fall into that category?
There's not been any evidence of that to this point, and we're still learning. So I can't sit here on May 21st,
Yes,
and say that definitively that's impossible. And we've talked before that I think that certainly, when you're talking about a country with 330 million people and a global population of 7-8 million, there are going to be a few individual cases here and there. Where I think that is most likely are people that have significant immune system issues that they may not mount sustained antibody response. But
Yeah.
Again, we can say off of lots and lots of evidence from all sorts of infections in the past that it's very likely that at least for a couple years that people who have reasonably strong immune systems that they will mount some sort of sustained antibody response, and as a result, they will stay immune for, again, at least a year or two, if not longer.
So on that front, have you heard anything that excites you when it comes to a vaccine or something?
Excites me? Not, not at this point, but there is an unprecedented push. Vaccines typically they're not money makers for drug companies, and as a result, the amount of research and development is limited. This is something that, for lots of reasons, there not just in the U.S. but globally, there's just a tremendous push, and so there are labs all over the world. They're talking to each other in varying amounts. And then the other really important component is that once, and this has already started to happen, that there have been a few vaccine candidates that have already emerged as looking more promising, and then you have to start putting them through 3 different phases of clinical testing. And the advantage of having a global response is that the number of people who can enter into trials is expanded,
right,
just limiting it to one country.
Right. That's excellent. Well, I think that's excellent news and exciting. Now, have you heard, and I got to be honest with you, I have to plead ignorance here. When are we going to look at phase 2? And I don't want to push it. I know we just started phase 1, but is there talk?
I'm in like phase 6.
Is there talk of phase 2 and when that may happen for Southern Maryland, or at least for Calvert and St. Mary's?
So I'm not trying to dodge the question, but honestly, I have no input at the state level as to when that will occur, and whatever I would say would have no more validity to it than the two of you speculating on it.
Well,
hey, whoa, hey, doctor.
My speculation carries much weight.
Not that medical professionals such as the two of you.
Right, of course. Well, let me ask you this, though, as kind of a generic question, and I think Heather hit on it earlier. On some level, you got to be pleased, maybe not go so far as relieved, but certainly pleased to see the stage 1 or whatever we're doing. I mean, it hasn't been like this tidal wave of sickness hitting the hospital, correct?
Correct. And so as we head into Memorial Day weekend, again,
oh gosh, just like
yeah.
Easter,
well,
right?
And that's exactly what I was going to say. That this is, we have to really take a look at this, and I think most people to some degree are, as more of a marathon certainly than a sprint. And we've gotten through the first stage of the race in pretty good shape. Especially in the southern counties. When you look the 2 weeks after Easter statewide, they had a pretty significant spike in cases, both in the number of cases detected and then in hospitalizations. We did not see that in the southern counties. And so as we approach Memorial Day, I know people are tired of all the restrictions, and some of those have been lifted. But we're going to have these milestones where people typically, it's part of our national culture that we get together for things.
Yeah.
It's not that people need to stay in bunkers over Memorial Day, but they, again, need to think about limiting the number of people. If they have a cookout, preferably that people are outside. Again, they try to limit to 10 or fewer people, and that the people they invite don't live with older relatives or people that have significant health problems. So, again, people should be able to enjoy themselves. It's just that we have to consider that one bad weekend, we could see what happened across the state with hospitals that are maxed out, and then we set ourselves back.
Okay, can I ask you a question? And I'm so glad you brought up the hospitals maxed out. There was talk, and they played it over and over on the news, on the DC news, about this morgue in Laurel at the ice skating rink. How many bodies are there at that ice skating rink? Are they, I don't mean to say that there aren't people that are dying in Prince George's County and Montgomery County, but the way they made it sound like they're stacking people up where kids used to skate. I mean, are you familiar with that morgue and what's happening there?
I'm not. I will say that at least on the calls that I've been involved with, which is quite a few from state level, I have not heard about these auxiliary facilities actually being put into use.
Mm-hmm.
And so I don't know if there's truth to that. But no, I've not heard about any issues with the funeral homes being able to
keep up.
To properly take care of what they need to.
Well, I think it's kind of like MedStar St. Mary's. I mean, when they built this tent thing, it was in prep in case of.
And every hospital across the state has secondary backup plans if their hospital goes to overflow. So at Calvert, I know that the hospital has been at 50% or lower capacity throughout.
Wow.
And that's in part because elective procedures were postponed for a few months. So routine surgeries, there was no hospitalizations as a result. And as we talked about on previous calls, that unfortunately some people who really should have been coming in for care were apprehensive or afraid to come into hospitals and were maybe neglecting other facets of their health. But regardless, their capacity being less than 50%, they were actually taking some cases from Anne Arundel where they've had higher amounts of cases. So even with Anne Arundel, where they had higher amounts, they did not need to go to a second facility. They were able to transfer a few cases to counties like Calvert, where we've kept our case counts much lower than.
Yeah, what is with us? Are we just better than everybody else? Or
I think we're better.
Or is it just that our population is lower? Because it sounds like
we're
doing
better.
Pretty darn good.
We're better.
It's a combination. So people across the community as a whole really have been doing a great job. I think people have been respectful of each other. Not everyone has had a face mask on, but I think the majority of people have. Nursing homes, again, fortunately have not been an issue in our county, and that's a high percentage of people who've ended up in ICUs and hospitals. So a combination of the work they're doing in nursing homes. I have to give a little shout-out to our own local health department and the work that our nurses have done in conjunction with our congregate living facilities. And then the hospitals themselves, I think that the doctors and nurses in all of our local hospitals have done a tremendous job taking really good care of people who have needed whether it's ICU care or more general hospital care for coronavirus.
I think you've all done an exceptional job. I really do. And I guess until next week, maybe we'll talk about phase 2. Maybe the governor will throw something down. But I do want to thank you and everybody who's working so hard out there to keep those numbers down and for taking time to talk to us every Thursday. I think this is week 10, I think, or we're close to that. So we really do appreciate you, Dr. Polsky, and all the folks there for calling in and keeping us up to date on what's going on. So until next week, okay?
All right. Take care.
All right. Stay safe and healthy. All right. Bye-bye.
822 phone lines are open for you. Always good to touch base with them.
I think we're just better.
Oh, we are just better. I mean, he doesn't want to say that. I mean, there's some political aspects to his job as well.
I know that was a strange question about that morgue in Laurel, but I've had people call up and say, "What is going on with that?" I don't even think they're using that as a morgue, right? And to hear the D.C. media talk about it, it was like, "Oh my gosh, there's so many bodies. We have to open up the ice rink and put bodies on the ice." It was
they were just. I think you were spot on in your assessment. They were saying, look how many people are sick. Look how many people are dying. If this continues on, where are we going to put? We better start doing something now, planning ahead. And so they started getting things in order to do that. And that's a good thing that they should plan ahead. But yeah, it's just, it's like everything.
Say it in the story that bodies aren't there now, but just in case.
You're asking modern media to be responsible journalists and to be ethical and to dot their I's and cross their T's. That doesn't happen. It doesn't happen. It hasn't happened in quite a while. The standard for journalism is at an all-time low, and Unfortunately, this is what is passing. And this is the other thing. Everybody with a phone calls themselves a journalist.
Mm-hmm.
And they go out and they say, I'm a journalist. No, you're not. You don't know what the hell you're doing. It was just like when I jokingly said we're pretty much doctors, and he didn't respond to it. It's the same thing. You have to know what you're doing, and you have to be responsible, and you have to cover the who, what, when, where's, and whys of a story.
I think we got him to laugh in there, though, didn't we? At that one point
maybe
when
a
he
chuckle.
said, "Well,
Make a
be
smirk.
like you guys saying, hey, whoa."
Yeah.
I think so.
Probably smirk at best. But that's what passes for journalism
Right.
today. It's just, it's all rumors, conjecture, and opinion.
Nonsense.
That's what it is. And then we all, are spoon-fed that on a daily basis.
You have to wade through it.
You got to wade through it.
But who has time for that, seriously?
Exactly. 8:24, let's see what's going on with the weather.
Southern